Let's dive into the discussions shaping the nation.
Good morning, Minister. I've been told by people working within the health service that there are senior healthcare professionals at the moment, some of them including consultants, who are creating their own private companies, diverting patients from public waiting lists to their newly created private companies. It has been alleged in one case that a consultant who created this private firm to read scans used the hospital public waiting lists to then funnel work through rostering into his own private company. An incredible situation, a major conflict of interest for anybody in a public role to be doing this in relation to their own businesses. You must admit, Minister, it must not be allowed that anybody on the public payroll should be in a position where they're creating a private company and funneling public work to their own private company. Now, I put a PQ to the Minister for Health a couple of weeks ago to see if this practice was widespread within the sector, and the response I got is actually quite shocking. An internal audit report, which was carried out by the Office of the Chief Internal Auditor, was written less than a year ago, and its job was to ascertain if private companies were used to provide additional services such as this, and it found that there was a major breakdown in terms of compliance and in relation to value for money as well. UHL, for example, was found not to have conducted an open procurement process, with €14.2 million paid to these types of providers just in 1 year, 2023. And management confirmed that there were no dedicated procurement functions within the group in relation to this. In UHL, 2 private providers were owned by or part-owned by 2 separate UHL employees. A third company was owned by a HSE employee with another hospital. Now, this corroborates the allegations that have been made to me in relation to this practice happening. That report states that the government were getting a handle on it, but it's currently the actual case where we're hearing of this happening in real time at the moment. Now, hospitals have work coming at them at a fierce rate at the moment. I know of one hospital that has 960 biopsies at the moment. That's a backlog of 960. Within that backlog, there are people with cancers. There are delayed diagnosis, delayed treatments, and more negative outcomes as a result of this. It's clear that there's not enough beds within the system. It's clear that investment is not getting to the front line, that it's getting caught up in administration. The population of the state grew by 100,000 people last year. And your pay and numbers policy is an effective recruitment embargo on the health service. Now, the INMO are having their conference today. Will you send a message to their conference today to say to nurses and doctors that you have their back? Will you send a message to say that you will end the practice of public staff creating private companies and funneling patients from public lists into their private companies in future?
Thank you. Minister Chambers.
Thanks very much, Ceann Comhairle. And the matters you've raised are very serious and need to be properly and thoroughly followed through by the HSE. And there obviously are references there to conflicts of interest and value for money concerns, which are extremely concerning. And under initiatives to reduce waiting lists, the HSE can outsource to private hospitals under the Surgical Services Framework and the Private Provider Framework. The HSE look internally within and across hospital sites to deliver insourcing pathways, and as part of the waiting list action plan, there is a focus on deploying additional weekend, evening and out-of-hours activity to reduce overall waiting lists. The HSE CEO, I understand, at the request of the Minister for Health, has initiated a detailed survey of all insourcing activity within the HSE, which will be assigned by Finance, Internal Audit, HR and Access Integration functions. The HSE CEO has also issued an instruction that all insourcing where existing staff are hired, engaged or paid by a separate entity to work on initiatives in their own place or type of work must now be paused. Only insourcing where the HSE directly engages its own staff through payroll can continue until this survey is completed. The ultimate aim of this work is to move beyond the dependency which you've referenced on insourcing or outsourcing in favour of planned, stabilising rostering of all staff. There was an internal audit which you referenced on insourcing in UHL, which found that consultants that were carrying out insourcing in UHL. The audit found that consultants set up private companies and referred patients to their own companies, tender processes were not appropriately followed. The CEO of the HSE has instigated a review of insourcing, as I've said, across the HSE, not just because of the above audit, but also due to broader concerns about how it is operating and value for money considerations. In relation to the instruction to pause work where existing staff are hired or engaged by a separate entity to work on initiatives in their own place, they're examining all arrangements and contractual agreements in an effort to pause this work as quickly as possible. So I have to say, having been made aware of this, it is serious, and if appropriate procedures haven't been followed, there has to be full follow-through from the HSE, and all dimensions of the respective financial frameworks should be followed by anyone working within the HSE relating to insourcing and indeed outsourcing, and I've tried to provide some clarity on the matter today.
Thank you, Minister Deputy Tóibín.
I welcome the pausing of this insourcing, but the question has to be asked, why is this happening? Now, I've spoken to a hospital in the Midlands just today with staff within that hospital, and they've told me that they had a red escalation just over this bank holiday weekend. They said this is unheard of in the middle of summer. It happened in December and January. That they are being told to get patients out of the hospital, free up operations and other elective engagements so that they can orientate staff towards the people in those EDs. There's 461 people on trolleys today. That's 461 people that are crowded into hospitals overnight, lights on, not getting to sleep, etc. We have 50,000 hospital appointments cancelled so far this year, 800,000 hospital appointments cancelled just in the last 4 years, and today there are 800 vacancies for consultants. So we have a major crisis happening in terms of resources in this hospital, and that's why this is happening. So it's not just good enough to pause it. What we need is to get rid of the pay in numbers embargo on staff so we can actually resource the treatment that needs to be delivered to the patients.
Minister Chambers to respond.
The main areas of focus for the new Minister for Health has been the absolute need to address work time during the evenings, but also over the weekend. And the Minister has been proactive in managing that over the last number of weeks in particular to ensure that we have a greater presence of senior consultants and others across the hospital system to try and accelerate discharge and provide senior oversight within the clinical environment over the weekend period. And I think you're seeing the positive outworking of that in that ongoing management and work between the Minister for Health and the HSE. Related to the pay and numbers strategy, there's a significant increase in the health budget that was agreed last July between Minister Donoghue and Minister Donnelly last summer, that we gave a multi-annual 2-year certainty to the HSE to manage their overall pay and numbers in the context of a 2-year framework. And that was welcomed by the HSE at the time, and indeed the hospitals existing within it, particularly the tertiary hospitals and others, so that they could accelerate recruitment over that window of time. And I think that's had a benefit to the HSE in terms of managing increased clinical workloads.
Now, and just
like, share, and subscribe, and let us know your thoughts in the comments. We'd love to hear from you.